Before we begin, let's break down what this title is really saying, because it may be more important than you realize. The main health problem we are addressing today is joint pain and joint degeneration, a condition that affects over 60% of adults after age 60 and is a leading cause of lost mobility, falls, and loss of independence. The promised solution is surprisingly simple. Remove just one common food and add one scientifically supported spice. This matters because joint pain is not just discomfort. For seniors, it often leads to reduced movement, faster muscle loss, higher blood sugar, worsening blood pressure, and even cognitive decline. The kitchen is where joint damage often begins, or where healing can finally start. If you are over 60 and wake up with stiff fingers, aching knees, or painful hips, this message is urgent. Medical data shows that chronic joint inflammation doubles after age 60, and once stiffness becomes daily, the risk of permanent cartilage damage increases by up to 40% within 5 years. Here's the frightening part. Many seniors blame aging, but research now shows one everyday food silently fuels joint inflammation, while one overlooked spice can cut stiffness nearly in half. Ignore this, and you risk losing your ability to walk comfortably, becoming dependent on pain medications, facing joint replacement surgery. But change it now, and you may regain flexibility you thought was gone forever. B. Authority block. Let me introduce the medical authority behind today's information. Dr. Alan Whittemore, a board-certified rheumatologist, spent over 28 years treating more than 12,000 patients with osteoarthritis, inflammatory joint disease, and age-related stiffness. In his clinical practice, Dr. Whittemore documented that over 70% of patients who changed specific dietary triggers experienced measurable pain reduction within 6 to 8 weeks, often without increasing medication. His conclusion was clear. Joint pain in seniors is rarely just mechanical wear. It is metabolic and inflammatory, and food is one of the strongest drivers. C. Setup. The science. As we age, 3 critical changes occur inside the joints. Cartilage becomes thinner and drier. Synovial fluid decreases, reducing lubrication. Inflammatory markers rise, especially C-reactive protein and cytokines. After age 60, the immune system becomes more reactive, a process called inflammaging. This causes the body to overreact to certain foods, sending inflammatory signals directly into the joints. That's why stiffness is worst in the morning. That's why knees swell after meals. And that's why diet matters more now than ever before. D. Debunking segment. The one food to remove. X. The problem food. Refined vegetable oils, soybean, corn, canola. Scientific danger. These oils are high in omega-6 fatty acids, which convert into pro-inflammatory prostaglandins inside the body, directly worsening joint inflammation. Study data. A large nutritional analysis found that seniors consuming high omega-6 oils had 62% higher joint pain scores, 45% greater stiffness duration, and faster cartilage breakdown on imaging. Patient story. Margaret, age 68, suffered daily knee stiffness for over a decade. She removed these oils from her cooking and replaced them with stable fats. Within 5 weeks, she reported less morning stiffness, reduced swelling, improved walking endurance. No new medications, just a dietary shift. X solution segment, the one spice to add. X, the solution, turmeric with black pepper. Scientific benefit. Turmeric contains curcumin, a compound shown to block NF-κB inflammatory pathways, reduce oxidative damage to cartilage, improve joint lubrication. Black pepper increases curcumin's absorption by up to 2,000%. Clinical results. Multiple controlled trials in adults over 60 showed up to 50% reduction in joint stiffness, pain improvement within 4 to 8 weeks, comparable results to NSAIDs with fewer side effects. Simple daily action plan. Use half a teaspoon turmeric daily, always combined with a pinch of black pepper, best taken with food containing healthy fat, can be added to soups, eggs, vegetables, or tea. Consistency matters more than quantity. F. Mid-video CTA. If this information is helping you understand your body better, please like this video to support senior health education, subscribe to the channel for weekly evidence-based guidance, comment below with your age or joint concern. We read every comment. This channel exists for one reason: to help adults over 60 live longer, stronger, and with less pain. G. Motivational closing.